Hello, my name is Mary Raed Mina. I'm in St. Clair's College, grade 6, class A. Today I'm going to talk about the virus that had spread and continuing this. I'm going to talk about COVID-19, which we say Corona. So now let's start with the overview. Coronaviruses are a family that can cause illnesses such as the common cold, severe acute respiratory syndrome, and the Middle East respiratory syndrome. In 2019, a new coronavirus was identified as the cause of a disease outbreak that originated in China. The virus is now known as the Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. The disease it causes called coronavirus disease 2019 COVID-19. Cases of COVID-19 have been reported in growing number of countries, including the U.S. public health groups such as the World Health Organization and the U.S. Centers for Disease Control and Prevention are monitoring the situation and posting updates on their websites. The World Health Organization declared a global pandemic in March 2020. These groups have also issued recommendations for preventing and treating the illness. Symptoms. Signs and symptoms of COVID-19 may appear from 2 to 14 days after exposure and can include fever, cough, shortness of breathing, or difficulty breathing. Other symptoms can include tiredness, itches, runny nose, sore throat. The severity of COVID-19 symptoms can range from very mild to severe. Some people have no symptoms. People who are older or have existing chronic medical conditions such as heart or lung disease or diabetes may be at higher risk of serious illness. This is similar to what is seen with other respiratory illnesses such as influenza. When to see a doctor? Contact your doctor or clinic right away if you have COVID-19. Symptoms. You have been exposed to someone with COVID-19 or you live in or have traveled from an area with ongoing community spread of COVID-19 as determined by the U.S. Centers for Disease Control and Prevention and the World Health Organization. Call your doctor ahead to tell him or her about your symptoms and recent travels and possible exposure before you go to your appointment. Anyone with respiratory symptoms who hasn't been in an area with ongoing community spread can contact his or her doctor or clinic for further recommendations and guidance. Let your doctor know if you have other chronic medical conditions. As the pandemic progresses, it's important to make sure health care is available for those in greatest need. Causes. It's unclear exactly how contagious the new coronavirus is. It appears to spread from person to person among those in close contact. It may be spread by respiratory droplets released when someone with the virus coughs or sneezes. It may also be spread if a person touches a surface with virus on it and then touches his or her mouth, nose, and eyes. Risk factors. Risk factors for COVID-19 appear to include recent travels from or residence in an area with ongoing community, spread of COVID-19 as determined by the U.S. Centers for Disease Control and Prevention or the World Health Organization. Close contact with someone who has COVID-19, such as when a family member or healthcare workers takes care of an infected person. Complications. Complications can include pneumonia in both lungs, organ failure in several organs, death. Travel. If you're planning to travel internationally, first, check the US Centers for Diseases Control and Prevention, the World Health Organization websites for updates and advice. Also look for any health advisors that may be in place where you plan to travel. You may also want to talk with your doctor if you have health conditions that make you more susceptible to respiratory infections and complications. How to protect yourself against COVID-19. Number 1, wash your hands often with soap. Then if soap and water are not available, use the alcohol-based hand sanitizer that contains at least 70% alcohol. Number 2, avoid close contact with people who are sick. Keep at least 6 feet between yourself and anyone who is coughing or sneezing. Number 3, avoid touching your eyes, nose and mouth. Number 4, cover your cough or sneeze with a tissue, then immediately throw the tissue in the trash. Number 5, if you don't have a tissue, then cough or sneeze into your bent elbow instead. Never cough or sneeze into your hands or into the air. Number 6, clean frequently touched objects and surfaces daily, such as tables, countertops, doorknobs, light switches, and cabinet handles. Number 7, you have to stay home, especially if you're sick. If you have a fever, cough, and difficulty breathing, seek medical care, but be sure to call in advance. Number 8, and lastly, follow the US Centers for Diseases Control and Prevention's recommendations for using a face mask. Face masks are not recommended for use by the general public. Rather, face masks should be worn by people who show symptoms of COVID-19 to help prevent spreading the disease to others. Face masks should be also worn by people who are taking care of someone with COVID-19. And now, thank you for listening to me. I hope you like my project. Thank you so much.